But we want to begin right now with the latest headlines. The number of cases in the U.S. jumped again overnight to at least 102,000, with 1,600 deaths now. The U.S. now has more reported cases than any other country in the world. Nearly 45,000 of those cases are in New York State.
And some good news for the tens of millions struggling because of coronavirus. Those relief checks from the federal government could be in your hands in just 3 weeks. President Trump signing a $2 trillion relief bill on Friday. And some states are resorting to more drastic measures to stop the spread. In Rhode Island, police are stopping drivers with New York plates, telling them to quarantine themselves. And Florida's governor is telling people coming to the state from coronavirus hotspots they need to self-quarantine as well.
Our team is covering the story across the country and around the globe this morning. We want to begin with NBC's Erin McLaughlin in Los Angeles.
This morning across the country, over 100,000 cases, more than 1,500 dead, and an all-out war against COVID-19.
We go out there today and we kick coronavirus ass.
The state of New York now with the grim distinction of being the epicenter of the crisis in the United States. Friday, the death toll surged from 385 to more than 500. Among the lives lost, Mount Sinai nurse Caius Kelly.
He just had this infectious energy. You felt good when he was around.
Friday night, all across the city, a show of appreciation for those on the front lines. As doctors continue to warn, the system's overwhelmed.
It's like a war zone. We're in a war with very limited resources.
And a scramble to build makeshift morgues and field hospitals. New York Governor Andrew Cuomo to NBC's Lester Holt.
I hope this whole facility, Lester, stays empty. And we built it for nothing.
But you don't believe that's going to be the case?
The numbers don't say that's going to be the case.
In California, it's all hands on deck.
Every minute is a minute lost.
And a dire warning from officials. Los Angeles is just days away from the kind of crisis engulfing New York. This weekend, the USNS Mercy is expected to open, providing much-needed support to non-COVID-19 patients. As impressive as this ship is, it represents only a fraction of the city's needs. It has 80 ICU beds. LA officials estimate they need 3,000. New Orleans, too, emerging as a hotspot in the pandemic. NBC's Blaine Alexander.
Now, with the cases here in Louisiana growing faster than anywhere else in the world, the reality is that there are just not enough tests to confirm every case.
In Miami, a mandatory curfew. Orders to stay off the streets from 10 p.m. to 5 a.m.
It is growing quickly. I mean, every time I go into work, we have at least a few more cases.
Now there's a statewide ban on vacation rentals, in addition to a mandatory 2-week quarantine for anyone arriving from Louisiana and New York. In Rhode Island, police stopping cars with New York plates.
Right now, we have a pinpointed risk that we need to address, and we need to be very serious. And that risk is called New York City.
That was NBC's Erin McLaughlin reporting.
And also this morning, hospitals across the country should hopefully be getting more ventilators after President Trump, under pressure, officially invoked a little-used power of the presidency to get a major automaker to pitch in. But that automaker says they were already on it. NBC's Kelly O'Donnell is at the White House with the very latest on that. Kelly, good morning to you.
Good morning, Kristen. Despite the president's reluctance early on, he is now using the federal government's power to manufacture more ventilators and buy more where available over the next 3 months. A tight timeline, given the number of serious illnesses from coronavirus continues to rise in hotspots around the country. President Trump moved from talk to action on forced manufacturing of medical equipment.
Ventilators is a big deal.
After 9 days of discussing the Defense Production Act powers, Friday, the president finally used it when he says negotiations with General Motors to build ventilators hit a roadblock.
We didn't want to play games. If they don't treat you right, I don't call.
In a remarkable turnaround, the president, who had insisted last week the federal government is not the nation's shipping clerk.
We have to get these people on board. We're not looking to get into a big deal on price.
Now says the U.S. government can order ventilators to supply states and allies.
If we do, not need them, that would be wonderful. We can help a lot of great people all over the world. We can help them live.
Bristling at demands and complaints from some governors, Mr. Trump made known his expectations.
I want them to be appreciative.
As the virus spreads and deaths climb, the president backed off his push to ease restrictions by Easter Sunday, saying he will consult medical experts.
Life, then it's your safety. And if we need more time, they're not going to have a problem waiting it out.
The president was surrounded by Republican leaders as he signed the largest relief package in U.S. history. Democrats were not invited to attend.
I want to thank Republicans and Democrats.
Today, President Trump heads to Norfolk, Virginia to send off a Navy hospital ship. NBC's Courtney Cubie.
The next time the USNS Comfort is scheduled to be in port is in New York City. The 1,000 beds on this hospital ship will ease some of the burden on New York City's overwhelmed hospital system.
It sends a signal when the president is able to go there and say thank you.
And President Trump will return to the White House after his visit, saying he'll be very careful not to shake hands while in Norfolk. And General Motors is saying that it is working around the clock tirelessly and had been already agreeing to do this work when the president invoked the Defense Production Act. They hope to have in their Kokomo, Indiana production facility 10,000 ventilators made each month. Kristen?
A lot of hospitals eager to see that equipment soon. Kelly O'Donnell, thank you from the White House. Meantime, there is some hopeful news this morning in the fight against the coronavirus. The FDA has approved a new test that could give patients results in as fast as 10 to 15 minutes, helping to pinpoint the rapid spread of this outbreak. 50,000 tests a day are expected to be delivered as soon as next week. The agency is also expediting the use of an experimental new treatment that uses the blood plasma from recovered coronavirus patients to treat those who are seriously ill.
As we've been reporting, New York City has become the epicenter of this outbreak. We want to bring in Syra Madad. She is the Senior Director for the System-Wide Special Pathogens Program for New York City Health and Hospitals. She's been working for years to prepare that city for a health emergency. She's also featured in the Netflix documentary Pandemic, where she predicted something like this could be in our future.
What worries me is that it just takes one person to start an outbreak. We're basically human incubators. We can host a number of different diseases. It's just a matter of time where the next pandemic is going to start. We just don't know where or how, but we know it will.
Syra Madad joins us right now. Syra, we appreciate your time on this day. We know that on Monday we hit the end of that 15-day window, the end of the 15 days to stop the spread that the White House is telling us about right now. Can you give us a progress report? Are we making progress? Is there a sense that we might be out of this window at some point soon?
Well, we're still very early on in this epidemic here in the state of New York, and we're obviously not alone. What's going to happen here is going to happen in major cities throughout the country just in a matter of days to weeks. And so a lot of these cities are not far behind New York City. So you're seeing what's happening in New Orleans. You're seeing what's happening in Miami and other areas like Dallas. And so, you know, we are obviously the epicenter today. Tomorrow is going to be another city. And we just need to make sure our first and foremost priority is making sure that our frontline staff have the resources and equipment that they need. And it is coming in, but we just need to continue to advocate for it and get more of it, because it's not a matter of just a one-time injection. This is something that needs to continuously happen.
And following up on the question about the timeline, of course, we've heard President Trump talk about the fact that he would like to reopen at least parts of the economy by Easter Sunday. He seemed to back off of that a little bit yesterday, as our Kelly O'Donnell noted. But can you put this into perspective, Syra? What is the risk of reopening things too quickly?
Well, if we open the economy sooner and basically back down on social distancing, what you're going to see is much higher morbidity and much higher mortality associated with coronavirus disease, and an even more taxed healthcare system. Right now, healthcare systems are being overwhelmed, not just here in the state of New York, but obviously across the nation. You're seeing more and more cases pop up. And what's going to happen is that they're going to continue to become very, very overwhelmed. So when people need to seek care, not just for coronavirus disease, but for other health alignments that are still existing in today's world. People are still having babies, people are still getting in car accidents, heart attacks. We won't be able to provide great services for everything else that's going to be coming through those doors. So we need to make sure that we are not overwhelming healthcare systems.
Syra, we know that teams, emergency responders have been preparing for a pandemic like this for years, but now we witness the scramble to try to get those supplies that they need urgently right now. How were we caught so short when it comes to tests and PPE, personal protective equipment, and all the items that those first responders, nurses, and doctors need right now?
Well, at the end of the day, we rely on a just-in-time, supply chain when it comes to healthcare services. We don't keep a surplus of 4 or 5 months of personal protective equipment or equipment and supplies. You have enough resources that you need for a given time period. And it makes sense because obviously you don't want to waste resources if you don't need it. So it's the just-in-time economy and supply chain that we work towards. And so when instances like this happen, it's hard to predict how aggressive they're going to be or what their impact is. And so by the time you want to order more supplies, you have what you call even hoarding, not just shortages, but hoarding of equipment and supplies happening around the nation. And this is not something new. We saw this in H1N1. We saw this in Ebola, where people are ordering more than they need. And so those folks that actually need it, it's a backlog.
Syra Madad, we appreciate your expertise and your time this morning. Stay safe and healthy. Thank you.
Now, as we mentioned earlier, police officers nationwide are putting their lives on the line, as they always do. But this time, it's to make sure people obey government orders to stay home and to keep at a distance while they're outside. NBC's Kathy Park is in Studio 1A with that part of our coverage. Kathy, good morning to you.
Kristen, good morning. As we continue to stay apart to help slow the spread of the virus, officers are patrolling the streets to enforce social distancing. It appears a crackdown is working in some places, but the message isn't getting through to everyone.
These days, officers from California to New York are on the front lines keeping you safe by making sure you're keeping your distance.
But they have been enforcing it. Yeah, totally have.
That means breaking up large gatherings, crammed parks, and even monitoring businesses with growing lines.
There is no congregating allowed.
A ramped up response after crowds were seen defying federal health guidelines.
Due to the current health emergency, members of the public are reminded to keep a safe distance of 6 feet from others.
In New York City, the epicenter of the outbreak in the U.S., people are searching for relief from the indoors, heading outside for fresh air or some exercise, but reminded to play it safe.
I think people are pretty good at keeping their distance from each other. Everybody has the same goal in mind, to not spread it.
Mayors across the country giving police the lead on enforcing the rules, even if that means patrolling from hundreds of feet in the air.
That if we see people in groups, we're going to break them up. If we see a place that's too crowded, we're going to get people to disperse.
They will be issuing warnings and shutting down all repeat offenders.
Here in New York City, to give people some more options to spread out, several blocks have been closed off to traffic so pedestrians can move freely.
But during this outbreak, more officers are getting sick too. More than 500 uniformed members of the NYPD tested positive for COVID-19. A sobering reminder of the risks of policing during a pandemic.
I appreciate them. I appreciate them a whole lot.
And if crowding continues to be an issue here in New York City, Mayor Bill de Blasio has said parks could be the next to close. A decision on that will be made tonight. Kristen, Peter?
All right, Kathy Park, thank you for that report from New York.
Normally at this time of year, the race for 2020 would be at a fever pitch with candidates crisscrossing the country asking for your vote. But in light of the coronavirus, the campaigns are looking a lot different these days, obviously. NBC's Geoff Bennett has much more on that and what the candidates are trying to do about it. Geoff, good morning.
Hey, Peter, good morning to you. The coronavirus pandemic has temporarily transformed nearly every aspect of American life, including the race for the White House. Virtual campaigning is now the new norm for Bernie Sanders and Joe Biden. And with President Trump seizing the national spotlight day by day from the White House, the Democratic candidates have had to find new ways to connect with voters.
Who's going to get their say?
While the remaining 2020 presidential candidates are used to seeing adoring crowds on the campaign trail, the coronavirus pandemic has forced them to find new ways to connect with voters. For President Trump, daily briefings are now his daily substitute for campaign rallies.
We've done one hell of a job, and it's lucky that you have this group here right now for this problem, or you wouldn't even have a country left.
The president, who initially downplayed the virus's impact, boosting his re-election bid by blanketing the airwaves, with the leading Democratic candidate left pushing for a higher profile. Former Vice President Joe Biden, like most Americans, is following the CDC guidance to stay at home, and it threatens to blunt his momentum. Biden's campaign this week installed a television studio in his basement to help step up his public presence.
I'm chomping at the bit, but I am where I am, and I hope to be the nominee of the Democratic Party, and I hope I'm able to get my message across as we go forward.
Biden now holds virtual press briefings, appeared on a digital edition of Jimmy Kimmel.
Are you able to stay away from people during this time?
Well, I'm not officially quarantined, but I'm trying to follow the rules here.
Even hosted a virtual happy hour.
None of us want to be cooped up in our homes.
Meantime, Biden's lone competitor, Senator Bernie Sanders, is signaling he's pressing forward despite trailing in the delegate count. This week, he held a virtual town hall. Sanders perhaps remaining in the presidential race for months to come, since now more than a dozen states have postponed their primary elections out of fear that in-person voting right now could spread the virus. Now, even though Joe Biden has opened up a nearly insurmountable delegate lead over Bernie Sanders, Sanders says he's actively pursuing the Democratic nomination, even says he wants to participate in a potential April debate if one happens to be scheduled. Joe Biden, though, says there have been enough debates. He wants to bring this Democratic primary to a quick close. Kristen, Peter?
No campaign stops to go to. Geoff Bennett's here in D.C. Geoff, thank you very much this morning.
Appreciate that. And we know that a lot of this can be overwhelming, but we want to make sure we're shining a light for you on some of the good news every day. Moments like this one, brave healthcare workers being cheered on for their heroic efforts. Take a look. Emotional moment there. Ashlyn Jewell is a nurse at the Swedish hospital in Seattle, and she was brought to tears by the sound of the community cheering for her and her colleagues. Her girlfriend says it's been a difficult few weeks, and those are happy tears to be recognized and also appreciated. And Peter, we can't say it enough. These are the folks on the front line.
Yeah, it gives you goosebumps. And we all across the country need to do the same and help cheer these people on, because we're going to be at this for a while. We're so grateful for them. There is a movement going on right now to help protect healthcare workers who are treating coronavirus patients with a potential shortage of masks to protect them. Some people are now taking matters into their own hands, and all they need is some cloth, needles, and thread. NBC's Kerry Sanders explains.
Y ya está. Perfectas. From Spain to Cuba to the United States, an army now at work sewing masks for healthcare professionals. Amanda Leonard with her mom Nancy, like the iconic Rosie the Riveter from the 1940s.
I think it reminds me so much of World War II. I'm a big fan of that era, and I remember seeing factories being opened and transformed to make, would make cars, and then they made airplanes, and they made war equipment. And I think that's kind of what's happening in our own garage. Yeah.
One of the nation's largest fabric stores, cutting squares, making kits, for a steady stream of volunteers ready to use skills many say they learned from their grandmothers.
Some thread, the instructions on what to do, the elastics to put around the ears, and some extra fabric to make the masks.
In their garage in Central Florida, mother and daughter taking turns swapping seats, with stay at home now the watchword, an opportunity to spend time together and for a daughter to learn a new skill. And this is a mission.
It is now.
Yes, yes. It feels wonderful to be able to do something to help.
The homemade masks are not designed to replace the N95 masks, which are effective. Instead, they're supposed to go over those masks because healthcare workers are having to reuse them. They're in such short supply. Kerry Sanders, NBC News, Orlando.
Important to point out that those masks, including the one that Kerry, of course, just demonstrated, are taken to hospitals, sterilized, and then given out to healthcare workers who need them. Great thing those families are doing right now.
Absolutely. Great to see everyone pitching